compulsory wearing of masks or working from home. But the Home Secretary, Susanna Reid, has urged the public to help combat the surge in COVID by taking up the offer of a booster dose 6 months on, no earlier than that, from the second jab.
However, the government's being accused of ignoring the danger signs despite the daily increase in infections and pressure on the NHS. There were 49,139 new cases reported yesterday, up 17% on the previous week. In terms of vaccinations, 49.5 million people have now had their first dose. That's 86% of the population. Second doses are at almost 80%, with more than 45 million people of all ages having had both of the vaccines. And in England, there have currently been just over 4 million booster jabs given out of an estimated 8.5 million who are currently eligible. That's 47%. And 1.5 million total doses have been given to under 18s since they have been eligible.
But look, here's the thing, and we've established this, I think, quite clearly on the programme earlier, if you weren't watching, and that is that there is real confusion in most people's minds, including ours here, about how you actually get the booster. Do you apply for it? Do you have to wait to be contacted? We're being told to contact GPs. We've been told by our GP in the studio that that's not a good idea because they're overworked at the moment and they will find it difficult to respond. So the smoothness of the rollout of the first 2 jabs, which was brilliant and an absolute triumph, seems to have been replaced by real confusion. So how can the Health Secretary get more people to get their booster jabs? And obviously, will COVID now be affecting more international travel? That's the other big question this morning.
Well, we're joined now by AGP, Dr Helen Wall, and also by aviation analyst Alex Macheras, and Dr Goody Singh, paediatrician, is here in the studio with us this morning. It seems, Dr Helen Wall, in Bolton, where you are Clinical Director of Commissioning, your vaccination programme is working very effectively. How many of those eligible for their booster jab have you actually delivered the booster jab to?
Hi, good morning. Thank you. Yeah, I mean, we've had a bad time in Bolton over the past 18 months, as everyone has, but, you know, the vaccine programme, we're pleased to say, has been a success and has certainly kept people out of hospital. And we've seen that massively in the fact that we've had 5 waves in Bolton and the last 2 of those have been much less effect on the hospital. So in terms of the booster jab, we've given about 20,000 booster jabs as of yesterday in Bolton. You know, we've got a bit of a way to go, but I'm confident that we are on target to get everybody jabbed by...
Yeah, but in terms of, I think what we're trying to establish, because the Health Secretary gave a very clear message yesterday that it's down to us to take up our booster jab. Now, when we were talking earlier, a number of us haven't had the invitation for the booster jab, so it's quite hard to take that up. And as I understand it, it's also not that straightforward to ring up and ask for one. What is the situation where you are? So I could just go back to my first question. Out of all of those who are eligible, 6 months on, over 50, in the top 1 to 9 groups, how many of those have you actually managed to jab and how many haven't you? I mean, do you have the capacity? Do you have the people who can deliver it?
So every single person who is eligible gets a letter from NHS England. So yes, some GPs will be ringing their patients because they'll be trawling through lists looking for who is eligible. But there are, you know, 5 million people who have been contacted so far. 4 million of those have been jabbed. There'll be another, I believe, another million and just over 1 million contacts in the next couple of days. What we need to remember is people are very keen to get the booster jab, but you can't have it until you're at least 6 months from your second dose. We are getting contacted by a lot of people who are like 2 weeks out of that 6 months, and we can't give it at that point.
What do these letters say? If you're past the 6-month point and you get the letter through your door, what does it tell you? Does it say you're now due, make this phone call, go online and register here? Or does it say turn up at such and such an address on such and such a date at such and such a time and get the jab? What are people being told to do?
So the letter will have 2 options. It will have a link to a website, which is the National Booking System website. You can go on there, put your details in, and you'll be offered appointments locally to where you live. Right. In Bolton, we have 7 of those sites. Or if you haven't got access to the internet, because we know that not everybody does, then you can ring 119 to have that talked through with you. I think the issue is that if people are ringing that or going online, they're being told they're not eligible because they're just a bit out of that 6-month period.
But surely if you get the letter, you are eligible.
Yeah, absolutely. But we do have people, if you Google it, you can find the link online. So we have people who are trying to get on there who aren't quite eligible. But certainly if you get the letter, you are eligible and you will be able to access an appointment.
Do you have an issue then? Because it sounds like you have an issue with people who are very keen, who aren't quite eligible, but you also have an issue with people you've contacted who haven't yet taken it up. So is that a problem?
Yeah, I mean, it's always going to be a problem when we offer anything like a vaccine. You know, there'll be people who are very keen, who want it before it's due, and then people who perhaps are a bit reticent about getting it at all, and then the people in the middle who, you know, will feel like it's just not a priority for them, and they've got other things to do this week or next week. So there is a real mixture of people coming forwards, as there was in the first and second phase of this vaccine programme.
Well, in that case, sell it, if you don't mind. Sell it now to people who've had the letter and, as you've just said, think, well, I've got a busy week and I have both jabs anyway, so I'm pretty well protected. I'll do it later. Sell the need for the booster because it's so important and it's so effective.
It is really effective, and we know that those people going into hospital are largely unvaccinated, or their vaccines may have waned. We know that people who are dying are largely unvaccinated from COVID. So it's really important that you get that booster. We cannot guarantee that the protection from the first 2 doses is adequate. As a GP, I'm starting to see people who perhaps have been jabbed twice being what seems like more vulnerable to COVID. So we're really keen to get everybody boosted as quickly as we can to protect them over winter. And it's important as well because we know that over winter we're likely to possibly get more variants.
And Dr. Goody, it's very important to point out here, isn't it, that if you are over the 6 months and therefore you're due the booster, you should have it because the effectiveness of the 2 vaccines that you had is starting to fall off the cliff, isn't it? After about 5 months, effectiveness starts to drop.
Yeah, I mean, the effectiveness of all vaccines and antibodies drops after a number of months. And we know that. We've got the evidence to show that. So absolutely, this is why we have the booster. And, you know, it's a great thing that we do have this as an option. This is a really great example of what Dr. Helen Wall was talking about, is what happens when you have good local public health. When you have the systems in place to make sure that you can have regular, consistent communication with the public, actually people will come and turn up. You know, they've done amazing things there to make sure that they can reach people. And part of the problem of why we're not getting everybody as quickly as we want is because we're not able to reach everyone. So there's something about access here and making sure that people who are vulnerable and want it can get it.
And can I just say, I think I'm the only person in the studio who's had the booster because I'm the oldest person in the studio, so I've had it. I just want to say this to people.
Well, Richard, because it doesn't look like you're the oldest person.
Anyway, I am, and there we are. The facts, figures are figures. But I just want to say this to people who've been offered the booster and are wondering about whether to take it up now. Psychologically, I'm just speaking from on my own account here. Psychologically, you feel so much better when you've had the booster. I didn't expect to, but when you've had the booster and you know that you've got super protection now, the best you can possibly get.
Does it make you look younger? Frankly, you look
younger
than me.
It makes you feel
superhuman.
More secure. It makes you feel more secure. It's good to do psychologically. Let's move away from booster now. We've done our best to sort of underline that.
Well, I think it's interesting, this travel development, because Alex Macheras, it feels like with the numbers that we've got, with the pressure on the government, which clearly led yesterday to their press conference, if we're not going to do this ourselves, introduce Plan B, other countries might start to do it for us. And Morocco, from midnight last night, stopped flights to and from, direct flights to and from the UK. That's going to affect people who are there right now, people planning to go there on their half-term holiday, and, of course, anybody else who is going to any other country might be thinking, when will they close their borders? What do you think?
Well, that's the thing, isn't it, Susanna? The worry is the domino effect, because, as you say, whatever the situation is here and whatever the travel restrictions are here in the UK, so the red list, the amber list that we had before and so on, that is only ever half the picture. And we don't hear enough of that often because there are still multiple countries around the world that are measuring and basing their travel restrictions on the COVID rate of other countries. And so while Sajid Javid has said here that, you know, cases could be up to 100,000, and that's something that the government is seemingly willing to accept, try telling that to a whole bunch of other countries that civil aviation authorities are looking at maps saying, well, hold on, Morocco, we as Morocco only have 10 cases per 100,000 in terms of the COVID rate. The UK has 445 per 100,000, and therefore they're sanctioning us and will other countries follow? You know, there are so many reasons to keep case numbers low from an aviation perspective, and from the leaders that I spoke to last night who are fuming about this, they are saying, from our perspective, this is just another reason to keep cases lower and to put those mitigations in.
Do you think countries, for example, such as America, which have opened their borders to people who've been double jabbed, and only people who've been double jabbed, from November the 8th, do you think they might change their mind then? People who've actually made a statement to say, OK, you're welcome back, Britain. Do you think they might do a U-turn?
Well, Richard, I would say that we shouldn't risk it. We shouldn't risk it because they very well could. With COVID, ultimately, countries only need to make one announcement with no justification, and you know, policies go into effect immediately. I'll quickly give you some context about Singapore. Singapore is very highly vaccinated. The overwhelming majority of the population are vaccinated there. Their case numbers have rocketed, and as a result, the US are now telling Americans, do not go to Singapore, even though their vaccine rate is so high. So I would say that, again, we shouldn't tempt other countries. Morocco made us here in the UK very public last night with this announcement, and other countries have sat up to think, you know, should we follow the same? Is this something to keep an eye on? For aviation, that's a disaster. But for the wider picture as well, it's just another reason why we shouldn't have these case numbers keep kind of bubbling up and simmering
Just
at
very
the top.
quickly, Dr. Goody, why would Singapore, being fully vaccinated, have such a problem? Very quickly.
I mean, there's any number of reasons why there could be higher rates, and just like we have in the UK, it might be that there's a sicker population. But what's really interesting about this, I think, is that it reminds us that we are a global, connected world.
Absolutely.
And we have to remember that the rest of the world also needs to be vaccinated if we want to be safe. We can't pretend that this is just going to be over, and we need to get our house in order before we can think about getting our freedom back.
That's very clear.